Are you thinking about getting knee replacement but don't know the signs or if you should get one? Knee replacements have been traditionally offered to older people with intolerable knee pain, the loss of highly valued activities, and end-stage osteoarthritis. However, this criteria has changed over time, and there are some very important considerations that should be taken into account. First are assessments. Self-reported patient outcome measures and assessments that focus on patient satisfaction can help you make your decision about surgery. Next is physical activity importance. Consider not only what you are able and unable to do, but also what is important to you and how your participation has been hindered by knee pain. It's also important to understand your preoperative status. This means what you're able to do before your knee replacement will determine many of the things you can do after your knee replacement. Finally, mental health scores should be considered because a low mental health score before surgery is associated with a lower mental health score after surgery. Although knee replacement surgery is one of the most commonly done and cost-effective musculoskeletal surgical procedures, you have the ultimate say of whether to proceed with surgery or not.